Assalamualaikum everyone, my name is Nadia Mohajir,
I'm Kinsley Khan.
and we are here today to talk to you about supporting Muslim survivors of sexual violence. We work for the organization HEART, which is a national organization that seeks to promote sexual violence literacy and sexual violence prevention in Muslim communities. And we do that through our 4 programming arms, which actually happens to be our acronym: Health Education, Advocacy, Research, and Training. So oftentimes we have interactive workshops, both in person and virtually, as well as health education materials on our website, so that people can feel informed about a lot of the critical issues that are pertaining to sexual health and sexual violence. We also provide advocacy for survivors who may need additional information or referrals to the services that they are looking for. And then we do research with academic institutions to build our knowledge and empirical data around the needs of Muslim communities. And finally, we train professionals and mainstream organizations, as well as Muslim institutions, on how to better serve the needs of Muslim communities. This lecture will be focused on helping folks think about what we need to do to be supporting survivors. We're also going to introduce our RAHMA principles and how and when to use them. And we're also going to help people understand the importance of being trauma-informed while supporting survivors. But before that, we wanted to just kind of set a foundation by going over some really important definitions of words that we'll be using throughout the presentation. The first one is sexual violence. And the way that we define sexual violence is all unwanted sexual acts, whether harassment, abuse, or assault, committed against another person without that person's freely given consent, is sexual violence and could be prosecuted as a crime. The key words here are without consent. Is really the key here in terms of what is actually attributed to sexual violence. And I want to also acknowledge that sexual violence ends up being a very big umbrella term and actually is a spectrum is a spectrum of violence. So whether we're talking about harassment or all the way to rape, there's a spectrum in between that consists of sexual violence. The next word that we want to define is trauma-informed, which is a strengths-based framework that is grounded in an understanding and responsiveness to the impact of trauma that emphasizes a physical, psychological, and emotional safety for both the provider and the survivor. And it creates opportunities for survivors to rebuild a sense of control and prevents opportunities for re-traumatization. And finally, we wanted to talk about victim-centered. We often talk about what does it mean to build victim-centered interventions and victim-centered communities. And by victim-centered, we mean that it is a systematic focus on the needs and concerns of the victim in order to ensure that the compassionate and sensitive delivery of services is done in a non-judgmental way. Moving on, we just wanted to sort of introduce some of the statistics of, sexual violence and what we know of how big the problem is in our country. And we know from mainstream data from the National Sexual Violence Resource Center and the CDC and other organizations that 1 in 4 girls and 1 in 6 boys experience some form of sexual violence before the age of 18. 1 in 4 women, undergraduate women, experience it on college campuses. We also know that 85 to 90% of victims are known to the perpetrator, and over 68% of victims do not report to the authorities. And we also wanted to sort of bring up what this data looks like similarly in Muslim communities. And right now, there's very, very limited data. And in fact, we're in the middle of conducting a few studies around trying to gauge the prevalence of sexual violence in our communities. And initial data is showing that the prevalence is very similar. About 20% of people are reporting having experienced sexual violence. And some of our anecdotal data is showing that the percentage of people who don't report is actually higher than 68%. So there's something happening here where victims don't feel comfortable reporting the violence that they're experiencing. This slide is a visual depiction of why victims don't tell. What is most important in this depiction is that the fact that these barriers occur at every level. So we're beginning from talking about, individual or personal barriers of self-blame, of fear of not being believed, fear or love of the abuser, to family and community barriers such as being shamed and ostracized, and to legal and institutional and structural barriers such as not having an anonymous mechanism to report or policies that criminalize survivors. So now that we've introduced some of the foundational concepts around sexual violence and understand sort of the prevalence and the depth of why victims don't feel comfortable reporting, we wanted to move on and sort of introduce the principles of what it means to be trauma-informed. Elliott et al. Have really introduced the principles, 10 principles of being trauma-informed, of having trauma-informed care in their paper. And we've listed just a handful of them that we thought were really important. The first one is around assuming survivorship. So the service delivery recognizes the impact of violence and victimization on the survivor. The second one, it really honors choice. So this means that the survivor that is engaging in this intervention has the conscious choice and control over their actions. It also uplifts collaboration with the therapist that is based on trust and safety. And finally, it also considers the cultural context of the survivor and accurately and appropriately responds to their needs.
So now from here, I'll talk about the RAHMA framework, which is the main framework that we use. So compassion is a core value of Islam, compassion being the translation of RAHMA. And how we respond to a survivor in the moment of a disclosure can be extremely transformative. It's very important for them, because if we don't respond well, it can actually be re-traumatizing. And this is true for everybody. So everyone should know how to respond to someone in the moment of a disclosure, even if it doesn't come in our professional capacity, because we can, in a social or informal way, be someone who someone discloses to. So it's very important for everyone to know. And then with RAHMA, these principles relate to the survivor who is disclosing. We're not talking here about accountability or about the person who is abusing in this situation. And so our supporting of survivors in this moment of crisis is an entirely separate process from the accountability process. So RAHMA stands for respond by listening, affirming and believing the survivor and what they're saying. And this includes not really questioning, their truth of what happened, honoring their cultural and religious values, which keep in mind there's subcultures even within Muslims. And so honoring those subcultural values, maintaining privacy and confidentiality, and then assisting with providing resources to them. So how can we challenge the barriers and respond with RAHMA? We're going to do a case study here just to kind of implement these. So a young woman experiences sexual assault by her fiance, and she does not seek help because she doesn't want her parents to know, given that their wedding is very close. That Friday, she attends a congregational prayer, and she hears the imam talk about zina, premarital sex, as being any sexual contact. She decides she wants to talk with someone, but the mosque doesn't have any trained professional for anonymous counseling. A friend convinces her to get a rape kit administered, but at the hospital, she's told that the time frame has passed. She is afraid to go to the police because her abuser is a Muslim male immigrant. So we're gonna see how these different levels play out in this story. And so, for the our part of it, for responding by listening, I would say, thank you for trusting me with your story. I understand you try to get help for your experience, but you haven't found the resources. So it's not my job to fix everything. I just need to respond and listen. The A is for affirming and believing. So I would say here, you're not alone. Many have experienced what you have, and there are people who can help. The H is for honoring the cultural and the religious value. So here, something like, I know you're concerned about how your parents and other family may react to this, given that the wedding is so close, and there may be important cultural considerations for you to think about. And here, every family is different. So this is where the subcultures also come at play. The M, which is for maintaining privacy. I would say something like, you don't have to tell anybody. There are professionals who can help that will keep everything confidential. I could also here even add that I will keep this confidential, and I would only say anything if this person wanted me to. And then A, assisting with providing resources, something like, you have many options for seeking help. If you desire, talking to a crisis counselor is one of them. May I help connect you to one? And this could be a really important one, because sometimes people want to, but they need that push and validation to know that it's okay to talk to someone. So this is a resource on our website that we have that we've developed that can help with the A part, which is assisting with providing resources. We have a lot of resources online, and every city and every state also has their own resources that people can find. So there's many different levels. So this includes mental health resources, legal resources, medical resources, and this offers a flow chart to show the various options available to survivors. And then finally, we wanted to uplift our most recent survey, which is exploring the burden of sexual violence, sexual dysfunction, and spiritual abuse in Muslim communities. Mashallah, we already have close to 500 respondents, and we're hopeful that this will give us a deeper understanding of the issues facing Muslim communities.
Thank you so much for the opportunity for us to present our work. Once again, my name is Nadia.
And I'm Kinsa.
And we hope that you enjoyed our survey. Please find us online or on Facebook and Instagram. And please do not hesitate to email us if you have any additional questions. Thank you so much.
Thank you.